Hello, so this is Chapter 18, Gender and Substance Use Disorders. Introduction. Substance use disorders in women has long been overlooked by society. This oversight was fueled because for many years women were less likely to use illicit drugs than men. About 10.2% of males and 5.5% of females struggle with a substance use disorder. About 11.1% of males and 6.5% of females have used illicit drugs. The gap between the genders is narrowing, however. History can give a distorted view of the recent and distant past. History suggests that mostly women were addicted to patent drugs. At the turn of the century, this was false. Women who abused or were addicted to a drug were subjected to a greater degree of social condemnation than men. But at the same time, their substance use disorders were viewed as less important than those of men. Only 40% of rehabilitation programs offer gender-specific treatment, opting for a one-size-fits-all model. Statement of the problem. Women's substance use disorders have historically been hidden. A goal was to protect her or to totally isolate her from social and/or family support. It is estimated that 6.5 million women in the U.S. struggle with a substance use disorder. The sexual double standards that often affect sexual activity are also seen in social perceptions of substance use disorders. Substance use disorders in women. So, SUDs in women are often missed by peers as well as physicians. Women with an AUD are 23 times as likely to commit suicide as women who don't drink. Women with a drug use problem are 50 to 100 times as likely to die as a result of substance use disorder than those women of the same age who do not use drugs. The existing research into substance use disorders has focused almost entirely on male subjects. Does gender affect the rehabilitation process? 1 of 4. Women who enter treatment are more likely to suffer from a psychiatric disorder that predates the development of their SUD. Current evidence suggests different brain activation patterns between sexes when exposed to drugs of abuse. Women's bodies also seem to break down alcohol and illicit drugs in a slightly different manner than men's. Women are more likely to experience side effects to the drugs used to treat SUDs. It has been suggested that women might become addicted to drugs of abuse after less exposure to that compound than would be true for a man. Women are less likely to enter a substance abuse rehabilitation program than men. It is affected by social barriers like stigmatization and external barriers to treatment, including child custody, limited funds, or a spouse who also has SUD. Few programs consider women with sole child custody. Men report often being introduced to drugs by peers, while women are often introduced by their partners. After entering treatment, men tend to externalize responsibility for their SUD, whereas women tend to blame themselves. Men and women may both support habits by spending savings, but men are more likely to sell illicit drugs, while women are often turned to prostitution. Work, gender, and chemical abuse. Women who are less satisfied with jobs or who work in male-dominated professions are prone to heavy alcohol use. Women are less likely to come to the attention of authorities and or their employer for poorer performances. They can mask SUD. If working a lower status job, a woman might find it easier to quit and find another job of similar status elsewhere. Alcohol use disorders in women. Within gender differences emerge based on age groups, which makes the discussion complex. Men drink for the euphoric effect. The majority of women abuse alcohol to self-medicate emotional pain. Women are more vulnerable to effects of alcohol, lower body mass, different fluid contact, less gastric alcohol hydrogenesis, and lower muscles to body mass ratio. Women require 40% less alcohol than men to achieve the same blood alcohol level. Physical complications. Telescoping. Notion that women experience alcohol-related complications earlier than men. Women appear to be at increased risk for central nervous system damage, developing damage after a shorter drinking history. Women with an AUD take half the time to develop cirrhosis of the liver as a man, with more fatal outcomes. Women taking birth control pills have a lower rate of biotransformation, leading to extended effects of alcohol. A positive note. Women are more aware of their AUDs and respond more positively to less involved interventions. Treatment outcome for women with AUD is equal, if not better, than those obtained by men. Women who complete treatment were found to be 9 times as likely to abstain than women who do not complete. A cautionary note. Many 12-step group models, like Alcoholics Anonymous, may be useful for women facing SUDs. The risk is that such models may also expose women to sexist views that are based on false pride on which addictions are often thought to rest. AA can lead to a reduced self-esteem and an increased level of shame for women. There are alternatives to AA that address the specific needs of women. Acetaminophen use disorder in women. Around the same number of women as men use methamphetamine. Men tend to use for euphoric effects, women for its ability to induce anorexia and control depressive symptoms. Women may be more susceptible to the effects due to hormone differences. Women who use amphetamines or cocaine are more likely to become victims of sexual violence. Benzodiazepine misuse by women. Research into benzodiazepine use by women is limited. Advertising campaigns for those drugs often promote women experience a significant drop in anxiety. These drugs are prescribed for women more often than men for certain conditions, like PTSD. Its use may be impacted by taking birth control medications, alterations to biotransformation. Cocaine use disorders in women. Progesterone levels may mute the euphoria in females. It can lead to higher levels of use during pregnancy. Due to interactions with birth control, may also lead to higher usage levels. Greater risk of adverse effects in women compared to men. Tend to begin using earlier and have greater vulnerability to addiction. Hallucinogen misuse by women. Ecstasy. Women and men may metabolize MDMA differently, which is related to the evidence that women are more vulnerable to MDMA-related neurological damage than men. Other research suggests otherwise, so the issue is under debate. Some studies have examined the relationship between MDMA ingestion and executive functioning and working memory. Premorbid functioning may also be a factor. Marijuana misuse by women. Women are more likely to start using it at an older age than men. The mean age is 17.6 years for girls and 16.4 years for boys. Men are at 3 times as likely as women to use marijuana daily, but women may progress to marijuana dependence more rapidly than men do. Increased risk for social anxiety. May use marijuana to self-medicate. Some evidence to suggest men may be more sensitive to the positive effects of marijuana. Marijuana may provide protection against psychosis and more so in women than men. Narcotics misuse by women. Women appear slightly more sensitive to analgesic effects of morphine than men. Approximately 57% of women addicted to opioids are addicted to prescribed narcotics, compared to 37% of males. Women tend to abuse these compounds at an older age than men. Usage patterns telescoped in women. Males addicted to narcotics were more likely to inject their drugs, while females were more likely to use inhalation. Research examining narcotic use by women has been fraught with methodology problems. Variables have been overlooked in studying how differences throughout women's menstrual cycles and use of hormone-based birth control methods might alter nicotine metabolism. Women and men might have different subjective effects of the nicotine, and the health consequences affect men and women differently. Women appear to metabolize nicotine more quickly, and men are more sensitive to the rewarding effects of nicotine. Myocardial infarction gender gap disappears in women who smoke. Smoking cessation. The potential for post-cessation weight gain often serves as a deterrent to smoking cessation efforts by women. Nicotine replacement therapies appear less effective for women. The average woman who smokes loses about 14 years of potential life. Myocardial fracture gender gap disappears in women who smoke. Smoking cessation. The potential for post-cessation weight gain often serves as a deterrent for smoking cessation efforts by women smokers. Nicotine replacement therapies appear less effective for women who attempt to quit with this type of support as compared to men. So that's it for this video. Thank you for listening.